hemorrhagic stroke be treated so that we can sort of minimize those numbers and there aren't consequences, or we don't have, unfortunately, a bad outcome after 6 months?
So I would say two things. Number one, that these are data, they are old data. I give this talk in different conferences. The mortality for brain aneurysm is going down dramatically since we started doing this technique. In United Kingdom, they have this healthcare system to collect all the data. It's amazing. We cut the mortality for ruptured brain aneurysm over half. Right. And in this country, it's the same thing. So good news, number one.
That is very good news.
These are numbers, are all numbers. But of course, the best treatment is prevention. So when a physician, a neurologist or a neurosurgeon or a radiologist finds an unruptured aneurysm, then the best way to treat it is to, before it ruptures, so you can secure it so it doesn't rupture anymore. And in fact, we're doing so many unruptured aneurysms that the incidence, meaning the number of patients presenting in Miami-Dade or in the States with ruptured aneurysm is actually going down for the first time in history. So it's great news for patients. By all the aneurysm that we're treating, we're actually cutting down the number of patients that actually have an aneurysm at birth, which is
But it requires to monitor the patient. So after surgery is completed and hopefully successful, there is a period where you constantly have to be monitoring this patient, correct?
Yes, usually the first, I would say, we typically do a follow-up study in 6 months, then within 1 year, then we do 3 years. And if the aneurysm is completely occluded at 3 years, then most likely it's never going to occur again or rupture again. And most of us, once the aneurysm is secure, is very unlikely. We just published other studies in which we studied the number of patients in which aneurysm was treated that actually end up bleed. And these numbers are extremely small. It's like 0.01%. So once aneurysm is treated, it's basically pretty much gone.